our last conversation, we had a lot of comments on YouTube asking about Dr. Ellie Phillips specifically. She has a protocol online. I know you're familiar with it. It's got some similarity to what we've talked about today, but some definite big differences too. In a really general sense, people want to know what you think of the way she goes about oral care.
Yeah, I get that question a lot. Actually, not as much as in the past, but you know, and you know, I don't want to say anything negative about anyone, any practitioner. Again, I'm not sure if she is still working or not, but she is a clinician. I believe she is a dentist, as far as I know. But her protocol is as far to the opposite side of the ring than from what I believe, or most functional dentists believe, and even a lot of conventional dentists. It's a very interesting approach to dealing with oral health. And the overall view is that she has 4 or 5 or 6 different mouthwashes and products and toothpaste and gum. And I'm not sure if there's a specific protocol or order, but these are products that she recommends. And I've listened to some of her stuff, and some of her stuff is great online. But this protocol is very confusing and baffling to me because it really shows no respect or regard for the latest science in the oral care industry and profession, and that is the oral microbiome. And now, if you go back 10, 20 years ago, it would sound absolutely reasonable. I do like her product. I think the first recommendation she makes is the xylitol gum. Forget what the name is, but I like it. I mean, it makes sense, and I would support her on that. What she says about xylitol, the product itself, looks pretty decent, and that makes sense. But all the other recommendations are something that maybe for a period of 2 weeks for an aggressive oral microbiome reset. Other than that, you would not be wanting to use this every day. Your blood pressure will go up, insulin resistance, you'll start gaining weight, you won't be very happy, you'll be miserable, you're going to start getting cavities, gum disease, bad breath. Again, I'm generalizing. I can support all of these facts. It's just not the science of today, and we know that by disrupting and disinfecting, killing bacteria, even though they come back in 10, 15 minutes, that this is not the way to go. You really want to be oral microbiome friendly. You do not want to disrupt or try and reset, or again, only if you are in really bad shape. But there's no daily taking down the oral microbiome. There is no good side to that. We've been doing that for over a century, actually longer. But with organized dentistry, we've been doing that for a long time, and it's still the number one disease in the world, tooth decay. It's not been working. In fact, a lot of practitioners, there's a pediatric dentist in Oregon, Dr. Stacy, who I think most of your viewers will know. She's seeing aggressive increase in decalcifications, white spot lesions. It's not getting better, even though we've had 100 years and more to really get it right. It's actually getting worse. And the reason for that is this kind of thinking. It has no scientific basis. There was no scientific basis back then, but we didn't have the science. So it was kind of just the logical thing to do, quote unquote. Clearly today it's not. It's an outmoded way of thinking, and I would steer people away from that kind of thinking. Again, in selected cases, there are products, some of them in her protocol, where if you used them aggressively for 2 weeks and then threw them away, stopped using them, and then started eating correctly, taking probiotics, working with your prebiotics, working with pH of saliva, and working with a dentist to try and rebuild and reset the oral microbiome. And again, none of those products would apply except for the xylitol gum. You would not want to see any of those products in that resetting of the oral microbiome.
And this ties back to what we were just talking about before, where in this day and age, people need to go to the internet and places like that to learn on their own, because likely their dentist isn't going to be up to snuff on what we're talking about. So people obviously are curious. They're commenting, asking your opinion. And we are in this world where people are becoming self-educated and bringing information to their doctor, to their dentist, and need to learn on their own. So I appreciate you sharing your thoughts, and I know a lot of people are going to appreciate that. If you enjoyed that clip, you're going to want to head over here and catch a full episode. I'll see you over there.
We use the word metal, we use the word amalgam, silver fillings. They're all the same. They're half mercury and half silver, and they add other alloys in there. So a lot of people are going to their dental offices. They're saying, take them all out. It's not being done properly, and they just inhale.